Hi, everyone. So my name is Jessica Vo. I'm a second-year emergency medicine resident at Magnolia Regional Health Center in Corinth, Mississippi. Today, we're going to be talking about a case that I had during my intern year that I found interesting. So we had a 49-year-old male that presented with abdominal pain and chest pain after being attacked by deer 3 days prior. He stated that he was sitting in the front of his yard when he noticed a buck appeared and it started charging at his wife. So in order to protect his wife, he got between the deer and his wife, and he was charged to the ground by the deer. Initially, he was seen by another facility, reported that he had an abdominal scan and said that it was normal. He had a few lacerations from the antlers, and those were repaired, and then he was discharged with prescription for Augmentin. Came to us 3 days later, stated that he had this worsening right-sided chest pain, abdominal pain, redness, and also had some nausea, fevers, chills, no vomiting, but did have some constipation and didn't know when his last bowel movement was. His vitals when he got to us, he was afebrile, a little bit tachycardic in the hundreds, a little bit tachypnic as well, but otherwise his oxygen saturations and his blood pressure were good. On physical exam, he did have prior lacerations that were repaired. There wasn't any pus drainage or any redness around it to indicate any signs of infection from it. They were well healed, did have some bruising kind of around the belly button as well. Severely tender. Whenever I would just touch him slightly, he would jump from the pain. His pain, though, was mainly in his right upper and his right lower abdomen, along with some redness kind of extending to the flank as well. He was complaining of some numbness in his legs as well, and he did have some mottling, but he had good pulses and he was ambulatory up until we saw him. He was doing well, ambulating, moving all extremities well. For his lab work, he did have an elevated white count of 14 with neutrophilia of 87%, low sodium of 126 and a lactate of 2.3. His liver function tests, though, were normal. We obtained a CT chest, abdomen, pelvis. His abdomen pelvis showed that he did have a right lower hernia defect, which he told me that he had repaired 2 years prior. But this hernia defect did show new small dilated bowel loops, along with some gas in the subcutaneous tissue as well too. So because of this, he was started on vancomycin, and then a consult was placed to general surgery. He was then taken to the OR for an X-lap, where he had a bowel resection, and there was noted to be perforations in his intestine in that previous hernia repair. So big learning objectives for this case is even in patients where you have a normal initial CT scan, if they come back with continued pain or worsening symptoms, go ahead and get a second imaging study to see if they have any delayed intestinal injuries or bowel injuries. CT scans are the best imaging modality for detecting perforations and intestinal injuries, but there still is that 15%, up to 15% negative rate with it. Theories as to why this kind of may have occurred in blunt trauma, especially with that force, that impact that he had, it could have definitely increased the pressure in his abdomen and forced the bowel to go through that previous hernia defect. Or it could be also due to shearing effects that could have caused devascularization as well. So I am open to questions.
Thank you, Jessica. I have a question. How is the patient doing now? Do you know?
Yeah, so I actually checked on his charts recently. He's actually doing well. He was in the hospital for about a week, discharged on Muram, and he's been doing fine. He did return to the ER department 3 months later. And he said that he noticed like a bulge above his belly button where that ventral hernia was repaired. So he got another CT scan, showed that he has an incisional hernia repair, but they decided not to operate on it currently. They said if he does continue to have pain or any problems with it, then they would in the future.
Thank you. Are there any other questions from the audience? Okay, thank you, Jessica.